don't work in people or patients who don't take them. It's quite simple. You would imagine that how much work has been done to develop pharmaceutical products that would be effective in reducing risk, whatever the disease is, but if it's not taken, you can't reduce that risk. It sounds very logical, but there's so many barriers in getting actually patients to take the medication. So it's seen as a new risk factor, but on the other side, medication non-adherence is on the patient side, but on the clinician side, it's always this problem of treatment inertia. That failure of a healthcare provider to initiate or intensify treatment or therapy when goals are not met. Why would that happen if we have such clear guidelines? So we have go through this process, developing therapies, going through rigorous clinical trials showing it's safe, it's efficacious, getting it into guidelines after many years of work, and then the guidelines are there, and the real life is there, and we have this discrepancy about what is really happening and why is that the case. It's very frustrating for everyone, and in the end, the patients are the ones who suffer.
Does it work? Of course, evidence suggests that good medical interview and effective communication can make really positive difference. It influences outcome. It's very, very important, and that's the reason why the beginning of medicine in our relationship with the patient as a person begin in good medical interview. But how to teach our professionals on communication skills? Of course, not like this is lecture. So cognitive learning is just cognitive learning. You can use books, you can use applications, everything for cognitive. It's not enough, and that's the reason why it's very important to have experiential learning. So we have a bank of 20 real patients in our School of Medicine. We call it Patient as a Teacher program. So we have real patients who are trained with different diagnoses to real patients, and we have simulated patients, actors, who act their disease, okay, like in Scotland or okay. So role play, of course, audio, video recording, and very important, feedback, okay.
Associations, I think today in 2025 have an important role to play within the healthcare system. Peer-to-peer sites are becoming more frequent. People need to speak to each other. We are also in France seeing salaried patient experts within particularly oncology services, where they're there to be the go-between, if you want, the facilitator with the healthcare professionals.
Nurses, one nurse in a room full of clinicians, are we just as good as clinicians in titration of medications? And this was a study that was published showing, yes, we are. Very small sample, I must say, and I'm sure there's other studies that's been published since then. But this small sample of a retrospective chart review showed that nurses were able to increase the number of guideline-directed medications. And also there was 62% were not on target doses at the initial visits, but then this was reduced to 18% during that short period. So nurses do have a key role in the titration program. And just flashing up again in terms of the benefits of this again is a Netherlands study. It's a retrospective study looking at 378 patients again with heart failure with reduced ejection fraction who were newly diagnosed. These patients were followed up for 9 months, and 68% were found to be on at least 50% of the target doses. And again, they concluded that nurse-led clinics did or were superior to standard care. And the reason for that, and the reason that this often a nurse-led clinic works, is there's close monitoring. We follow them up quite regularly. We very frequently have more time to talk to them, to communicate with the patient, to optimizing their medication, providing the education and self-care, providing that psychosocial support.
The second point again, is some better understanding of the problem, some awareness program. And you know very well that there are, in the last 2 years, there have been a lot of activities which have been focused on trying to improve adherence through some kind of public awareness. One of the most important was, I think, this declaration that was released at the time of the meeting of the International Society in Cartagena among the scientific societies, just try to promote some important concept. And on the other side, in the last couple of years, this World Adherence Day has been launched, and there is let's say, remarkable hope that this activity is taken in the future by big societies, by public societies like WHO, trying to increase the public awareness of the problem of hypertension.
So based on that, this World Adherence Day, when it was how we got inspired about it was, that was launched on 27th of March, as I said, as a global movement to raise awareness about the critical role of adherence in reducing the risk of cardiovascular disease and improving the cardiovascular health outcomes. So in collaboration, as I said, with 14 other scientific partners, World Adherence Day promoted the idea of adherence not just being a medical obligation, but a personal commitment and about sticking to the healthcare plan in entirety and not only taking the prescribed medications. Adherence must ensure that treatments are effective as intended, leading to better management of chronic conditions, fewer symptoms, and reduced complications, allowing fuller, healthier, and lives and greater independence. Strong adherence is able to reduce long-term mortality risk by about 20%. So these have been the snippets and the quotes which have gone into the various social media posts.
In my opinion, it's very important to work with a multi-professional team, at least in hypertensive field. It's very, very important to use and apply science evidence in our clinical practice. Of course, tools to increase adhesion, for non-pharmacological treatment, using all we have as scientific evidence, but another modern evidence, like for example, what we have found in the FIL trial, fixed drugs combination always as possible. Unfortunately, in Brazil, this is not a possibility at this moment for a public health system. And also ambulatory and home blood pressure as always as possible to diagnose and follow up this patient, and as I have also showed, to evaluate vascular age in the patients.